Imagine this, the late 1800s, gas lamps flicker in a wood-paneled doctor's office. A woman, dressed in a corset and layers of fabric, sits nervously as a stern-faced physician diagnoses her with hysteria. This wasn't just a scene from a period drama. It was a terrifying reality for countless women. For centuries, hysteria was a catch-all diagnosis for almost any behavior that didn't fit neatly into the rigid expectations of society. It was less a medical condition and more a tool of social control, a label slapped onto women who were deemed too emotional, too rebellious, or simply too inconvenient. Today, we're pulling back the curtain on this dark chapter in women's health, exploring how a supposed illness was used to silence and control, and how its legacy still echoes in the medical world today. So, what exactly were the symptoms of this mysterious ailment? The list was as long as it was bizarre. A woman could be diagnosed with hysteria for everything from anxiety, shortness of breath, and fainting spells to irritability, loss of appetite, and even a tendency to cause trouble. The very name, hysteria, comes from the Greek word hystera, meaning uterus. Ancient physicians, like Hippocrates, believed the womb was a free-roaming organ that could wander throughout a woman's body, causing all sorts of chaos and pressing on other organs. Yes, you heard that right, a wandering womb. This idea, though medically baseless, persisted for thousands of years. In the Victorian era, a time of extreme social repression, this diagnosis reached its peak. The ideal woman was supposed to be passionless, submissive, and domestic. Any deviation from this normal desire for education, a disinterest in marriage, or expressing sexual desire could easily land you with a hysteria diagnosis. It was the perfect medical justification for enforcing social norms. If a woman was unhappy with her confined life, she wasn't depressed, she was simply hysterical. Now, let's talk about the so-called cures, which were often more torturous than the supposed disease. One of the most famous was the rest cure, pioneered by Dr. Silas Weir Mitchell. This sounds gentle, right? Far from it. Women were confined to bed for 6 to 8 weeks, forbidden from reading, writing, or even feeding themselves. They were force-fed high-fat diets to make them gain weight, with the goal of restoring their nervous energy. The idea was to infantilize them into submission, breaking their will completely. Meanwhile, men with similar nervous conditions were prescribed an active West cure: horseback riding, hiking, and vigorous physical activity. The double standard was blatant. Then there was hydrotherapy, which involved a range of water-based treatments, from soothing warm baths to being blasted with high-pressure jets of icy cold water. Another disturbing treatment was the pelvic massage, performed by a doctor to induce a hysterical paroxysm, what we would now recognize as an orgasm. This was seen as a way to relieve the patient's nervous tension. The demand for this treatment became so high that it led one physician to invent a certain handheld, steam-powered medical device to make the process quicker and less tiring for the doctor. Yes, the first vibrator was a medical tool for treating hysteria. And for the most difficult cases, the solutions were even more brutal. Surgical interventions like oophorectomy, the removal of the ovaries, were performed under the horrifying assumption that removing a woman's reproductive organs would cure her unfeminine behavior. Clitoridectomies were also performed for the same reasons. These weren't treatments, they were mutilations designed to enforce conformity. For women whose hysteria was deemed incurable by these methods, an even darker fate awaited: the asylum. Thousands of women were institutionalized, often against their will, sometimes for life. Once inside, they were subjected to horrifying conditions, isolation, and further brutal treatments. The asylum became a convenient place to lock away women who were defiant, inconvenient, or simply didn't fit in. Husbands could have their wives committed with little more than a doctor's signature. It was the ultimate form of control. It wasn't until the early 20th century that the paradigm began to shift. Thinkers like Sigmund Freud started to re-examine hysteria, not as a wandering womb, but as a psychological issue rooted in trauma and repressed thoughts. While his theories were also deeply flawed and sexist, he moved the conversation from the uterus to the mind. This shift paved the way for the development of psychotherapy and a more nuanced understanding of mental health. The diagnosis of hysteria was officially removed from the Diagnostic and Statistical Manual of Mental Disorders in 1980. It took that long. But just because the word is gone doesn't mean the mindset has vanished. The legacy of hysteria casts a long shadow, and we see its ghost in a very modern problem: medical gaslighting. Have you ever gone to a doctor with real, physical pain, only to be told it's all in your head, or that you're just being emotional or anxious? This is the modern echo of the hysteria diagnosis. Studies consistently show that women's pain is more likely to be dismissed or undertreated compared to men's. Conditions that disproportionately affect women, like endometriosis or fibromyalgia, often take years, sometimes even a decade, to be correctly diagnosed, with patients being told their symptoms are due to stress or psychological issues along the way. The old belief that women are inherently more emotional and therefore less reliable narrators of their own physical experiences still permeates parts of the medical establishment. But understanding this history is the first step toward changing the future. It empowers us to advocate for ourselves. It teaches us to trust our bodies, to be persistent, and to demand to be heard. When you walk into a doctor's office, you are not a hysteric. You are an expert on your own body. Your experiences are valid. Your pain is real. The story of hysteria is a chilling reminder of what happens when medicine is weaponized against women, but it's also a story of resilience. By bringing this dark history into the light, we honor the women who suffered and arm ourselves with the knowledge to fight for the equitable and compassionate healthcare that every single person deserves. Thank you so much for joining me on this deep dive. If this history resonated with you, please hit that like button and share this video to help spread awareness. And don't forget to subscribe for more stories that uncover the past to better understand our present. See you in the next one.